all school staff need some basic knowledge about diabetes. Diabetes is a chronic disease that affects adults and children. It cannot be cured, but it can be managed. Diabetes management is 24/7. You have to time and balance your meals, exercise, insulin, or other diabetes medications, and monitor blood glucose levels. Generally, food, stress, illness, or injury can cause blood glucose levels to go up. Insulin and other diabetes medications and physical activity make blood glucose levels go down. Glucose, also known as sugar, gives us energy. Glucose comes from food, especially carbohydrates. It's carried from the blood into cells in the body by a hormone called insulin. People with type 1 diabetes don't make insulin, while people with type 2 diabetes don't make enough insulin, and/or the insulin does not work properly. With type 1 diabetes, which used to be called juvenile diabetes, the immune system is involved. For some reason, the body destroys cells in the pancreas that make insulin. This type of diabetes is called type 1 diabetes, and it is when there is no insulin being produced by the pancreas. It's the most common type in children and adolescents. The treatment for type 1 diabetes is maintaining blood glucose levels with a balance of food, physical activity, and insulin. In type 2 diabetes, the pancreas doesn't produce enough insulin, or the insulin being produced isn't helping glucose enter the cells. Type 2 used to be referred to as adult-onset diabetes, but is increasingly being seen in younger people. Inactivity and being overweight are risk factors for type 2 diabetes, so exercise and good nutrition are important to prevent and treat type 2 diabetes in youth. Sometimes oral medications, insulin, or other injectable medications are also required. But whether it's type 1 or type 2 diabetes, the problem is the same. The body's own insulin isn't doing what it needs to do to move glucose from the blood to the cells, where it can be used as energy. Not enough insulin means there's too much glucose in the blood, because it isn't getting from the blood into the cells in the body. This is known as hyperglycemia or high blood glucose. Too much insulin can cause the opposite problem, hypoglycemia or low blood glucose. Diabetes management is all about keeping blood glucose levels in a safe range. Not too high, but not too low either. This means having access to the necessary tools, like a blood glucose meter, insulin, food, glucagon, and sometimes other diabetes medications, and the school nurse and school diabetes team, which can include teachers, the principal, school secretary, cafeteria workers, and others, in order to maintain the proper balance. For the student's diabetes needs, a plan should be documented in the student's diabetes medical management plan, which includes physician's orders for the student in the school setting and other written care plans, and distributed to the school diabetes team. Diabetes can be serious in the short term if blood glucose levels become too low. Over the long term, high blood glucose levels can lead to complications like heart disease, stroke, blindness, amputation, and kidney failure. This is why good care is important. While diabetes is serious and does require 24/7 care, there's no need to be frightened or intimidated. The needs of the student can be safely and easily met when the school diabetes team has been properly trained and works together. The greatest immediate danger to students with diabetes is hypoglycemia. That's low blood glucose. Remember how it sounds. Hypo, low. The other thing you need to remember is that many times hypoglycemia cannot always be prevented. Be alert for a range of possible signs that something's wrong. Different students can have different symptoms. They may be lethargic or irritable. They may feel weak or unable to think straight. They may be combative, and they may start sweating. Hypoglycemia can come on suddenly without warning. Students can get tired or start feeling ill for any number of reasons.
Test your blood sugar.
No, I'm fine.
Are you sure?
If they're doing sports, they can sweat.
But
But if they've got diabetes, you need to watch for any change in behavior
Please?
or appearance.
Fine.
Hypoglycemia can be unpredictable. The student's condition can deteriorate very quickly. If not treated promptly, they may have a seizure, trouble swallowing, or they may faint. Be familiar with the student's low symptoms and treatment as contained in the Diabetes Medical Management Plan, and know where to find the student's low blood glucose supplies. Fruit juice, glucose tabs, or regular soda can deliver 15 grams of fast-acting carbohydrate. Your job is to intervene and treat before the student's condition worsens. And remember, a student experiencing hypoglycemia should never be left alone.
But that guy told me to pick it up.
Hypoglycemia can come on at any time, not just during sports. Sometimes the signs are not going to jump out at you.
So why haven't you
But
found
again,
him yet?
if you've got a student with diabetes, keep an eye out for the red flags. Watch to see if she's sweating or feeling weak when she shouldn't be, if she loses interest or looks pale or sleepy. Clammy skin can be another sign. But the main thing to look for is the change in behavior. A minute ago, the student was focused and looked fine. Very suddenly, though, she's lost interest, and she looks just
I'm
out
fine.
of it.
You have your meter in your purse?
It's in my locker, but I'll be okay.
Stay right there. I'm gonna get you some juice.
Hypoglycemia can sometimes affect the way people think. So don't expect the student to know what's happening, or even be cooperative. If you don't have a blood glucose meter, treat for hypoglycemia anyway. After a hypoglycemic event, kids need time to rest and recover. Because people with diabetes don't have enough insulin, their bodies can't move glucose from the blood into the other cells. The glucose builds up in the bloodstream. High blood glucose above target range is called hyperglycemia. To help you remember, think hyper, think high. Any number of things can cause hyperglycemia. It's possible that the student has forgotten to take insulin or hasn't taken enough. The student may have eaten more than planned. Food raises blood glucose levels. Stress, inactivity, or illness can also cause hyperglycemia. Among the signs are thirst, tiredness, dry skin, and stomach pains. Also fatigue, the inability to concentrate, and frequent urination are signs of hyperglycemia. Whatever the cause, you need to know how to recognize hyperglycemia. This is important.
Hang on a sec. Hang on a sec. Hang on just a
While
sec.
hyperglycemia should be avoided and treated in all students according to the Diabetes Medical Management Plan, which may include giving insulin, it is important to know that the onset of hyperglycemia comes on more quickly in students who experience insulin pump malfunctions. You're not expected to be a doctor, but when you have a student with diabetes and you notice that something's wrong, you've got to take action.
Hi, I'm Dr. Ruchi Gupta, and today I'll be talking about anaphylaxis and how to respond if it happens in your school. When it comes to managing severe allergies and anaphylaxis, it's critical that you have the tools to know it, see it, and treat it. First, it's important to know the basics about anaphylaxis, what it is, and who's at risk. Anaphylaxis is a medical term describing a serious, life-threatening allergic reaction that can happen within minutes, often without warning. It happens when the immune system mistakenly overreacts to what we call an allergic trigger. Common allergic triggers include food, stinging or biting insects, latex, medicines, or exercise. Avoiding known allergic triggers is the first step to preventing anaphylaxis from happening. But accidents happen, and sometimes people can develop severe allergies to something they've been in contact with before with no problems. That brings us to our second step. You've got to be able to recognize anaphylaxis when it occurs. Signs and symptoms can vary from person to person, and students may describe what they're experiencing differently than an adult would. Common parts of the body affected by anaphylaxis include the skin. Visible symptoms like rashes and hives are common, but aren't always present. Listen for verbal cues like, "My skin feels prickly," or "My arm feels strange." The airways. Listen carefully for any coughing or wheezing. A child might say something like, "My chest hurts," or "It's hard to breathe." Digestive system. The person may complain about an upset stomach or nausea, or may begin to vomit. Cardiovascular system. Chest pain, a weak pulse, and fainting can all be signs of a cardiovascular problem. Central nervous system. Dizziness, headaches, and confusion. For a child you suspect is experiencing anaphylaxis, this could be something as simple as, "I feel funny." Although there is no absolute rule, doctors generally identify anaphylaxis by one of the following. If the person has respiratory or cardiovascular symptoms, such as experiencing trouble breathing or chest pains, or if the person has symptoms involving 2 or more body systems, such as a skin rash coupled with nausea, or perhaps they develop hives and dizziness. When tragedies from life-threatening allergies occur, it's often because people had trouble recognizing anaphylaxis from a less severe allergic reaction. That's why it's critical to know the symptoms and the third step, how to treat anaphylaxis if it happens. A person experiencing anaphylaxis should be treated right away with an epinephrine autoinjector, such as an EpiPen autoinjector, and seek immediate emergency medical care after use.
EpiPen and EpiPen Jr. autoinjectors are for the emergency treatment of life-threatening allergic reactions, anaphylaxis, and for people who are at increased risk for these reactions. EpiPen and EpiPen Jr. are intended for immediate administration as emergency supportive therapy only. Seek immediate emergency medical treatment after use.
Seeking immediate emergency medical care is important because healthcare professionals must continue to monitor and evaluate the allergic reaction. In some cases, reactions can look like they've resolved or gone away, but the person can begin experiencing symptoms again. National food allergy guidelines recommend that those at risk for anaphylaxis have access to 2 epinephrine autoinjectors at all times. Having this access is important because up to 20% of people experiencing anaphylaxis require more than 1 dose of epinephrine before symptoms subside. If more than 2 sequential doses of epinephrine are needed, it should only be given under direct medical supervision. Please know that antihistamines or corticosteroids do not treat life-threatening symptoms of anaphylaxis. Epinephrine is the first-line treatment for a life-threatening allergic reaction.
EpiPen is injected into the outer thigh. Do not inject into your vein, buttock, hands, or feet. Use with caution if you have heart disease or are taking medicines that cause heart-related symptoms. Side effects may include faster, irregular, or pounding heartbeat, sweating, nausea and vomiting, difficulty breathing, paleness, dizziness, weakness or shakiness, headache, nervousness, or anxiety.
With an estimated 1 in 13 kids in the U.S. living with a food allergy and kids spending so much of their time in school, it's more important than ever to be ready if anaphylaxis occurs.
This is the EpiPen autoinjector. It comes in 2 strengths. One that's for patients weighing 66 pounds or more. As you can see, it has a yellow label. And one for patients weighing 33 to 66 pounds. That's EpiPen Junior. It has a green label. Whether you have an EpiPen, EpiPen Junior, or both, it's important to remember to refill your EpiPen prescription before it expires. You can find the expiration date right here on the autoinjector. Also, take a look to make sure the solution inside the EpiPen is clear and not discolored. And since it's important for you to have 2 EpiPens on hand at all times, EpiPen and EpiPen Junior come in 2 packs. Each 2-pack also comes with a training device. Even if you carry an EpiPen everywhere you go, it can only help you if you know how to use it correctly. In a moment, I will show you how to self-administer an EpiPen. You can follow these steps whether you're administering EpiPen to yourself or are a caregiver administering EpiPen or EpiPen Junior. So to get started, begin by removing the EpiPen from the carrier tube by flipping open the cap and then tipping the tube and sliding it out. It's important that you don't place anything in the carrier because this may prevent you from removing the EpiPen when you need to use it. Once you're ready to use the EpiPen, start by grasping the unit with the orange tip pointing downward. The needle comes out of the orange tip, so make sure you never press, push, or put your fingers or hand over it. Next, form a fist around the EpiPen with the orange tip down, and with your other hand, pull off the blue safety release. To inject, hold the orange tip near your outer thigh. Then swing and firmly push against your outer thigh at a 90-degree angle until you hear the EpiPen click. The EpiPen is made to work through clothing. Continue to hold the EpiPen firmly against your thigh for approximately 10 seconds to deliver the medicine. Now that the injection is complete, remove the EpiPen and massage the injection site for 10 seconds. Most of the liquid will still be left in the EpiPen after you finish the injection. Once you've used the EpiPen, get emergency medical help right away. Then place the used EpiPen back in the carrying case. As you'll notice, the cap of the carrying case will not close after the EpiPen has been used. And lastly, make sure to take the used EpiPen with you to the hospital emergency room. To properly dispose of expired or used EpiPen units and carrier tubes, make sure to take them to your doctor's office or to a hospital. A used autoinjector with an extended needle cover will not fit in the carrier tube.
Hey, did you know that nearly 5.6 million workers are at risk for exposure to bloodborne pathogens?
Yeah, so? I work for a school. How dangerous could that be?
True. Healthcare workers have the greatest exposure, but teachers and educational workers deal with a lot of potentially hazardous body fluids as well.
Yeah, sure.
You don't get it, do you? All right. First, you need to know.
What exactly is a bloodborne pathogen?
Bloodborne pathogens are microorganisms that can be present in human blood and can cause disease. These pathogens include those that cause malaria, hepatitis B, hepatitis C, and human immunodeficiency virus, the virus that causes AIDS.
All right, it sounds serious. But how am I supposed to come into contact with any of that? And let's say it happens. What am I supposed to do?
Don't worry. There are safeguards you can use to protect yourself against the health hazards from exposure to blood and other potentially infectious material. If you just follow some basic guidelines, not only can you avoid hepatitis B, but you can also significantly reduce the risk of contracting AIDS, hepatitis C, or other bloodborne diseases. Thanks to modern science, it is possible to prevent cases of hepatitis B, This can be done through a simple vaccination.
Get to the point. How does this exposure occur?
The most common way, besides unprotected sex, is through a contaminated needle stick. Chances are there are students in your school with diabetes. That insulin needle could be a hazard. But it's not just needles. You can be exposed to a blood-borne pathogen from any contaminated sharp object, broken glass, scalpels, or even pens and pencils. You also risk exposure through any contact with your mucous membranes, such as the eye, nose, or mouth. If you touch a contaminated surface, a blood-borne pathogen could enter your body simply by rubbing your eye or touching your nose, something you don't even think about.
Whoa, wait a second. What exactly can I be contaminated by? And what is this other potentially infectious material?
Other potentially infectious material includes mostly body fluids such as semen and vaginal secretions, but also internal fluids like spinal fluid or any body fluid that is visibly contaminated with blood. Besides that, there are extreme things like tissue and organ cultures containing HIV or hepatitis. You're most likely to find these in a medical setting, though. Body substances like urine, stool, nasal secretions, or vomit aren't considered dangerous unless they have visible signs of blood.
The key to protecting yourself is having a plan.
The first thing to remember in protecting yourself against blood-borne pathogens is to use what the Centers for Disease Control calls standard precautions. Treat all human blood and other potentially infectious material as if they are infectious. That means all of it. I know you work in a school and I know you love your students. All right, well, most of them anyway. The point is, you have no way of knowing if any of them might already be infected.
No. Here, put your nose right here. Make it slow, baby. You guys see what happened?
No.
All right, come on, let's get you cleaned up. You guys, y'all go ahead and play, okay?
Okay.
Connor, why don't you sit right here? You okay? I'm gonna get some paper towels and clean you up, okay?
In any situation where there's a potential for contact with blood, the following precautions should be taken. Whoa, wait. Always use personal protective equipment, or PPE. This is specialized clothing or equipment that should be provided to you by your employer for protection against infectious materials.
Whoa, that sounds serious. What does PPE look like? Plastic gloves? That's it?
Well, personal protective equipment can range from anything from gowns to face shields. In this case, yeah, gloves.
Put it on your nose. Hold this plan, keep the pressure on.
The point is, PPE is simple to use, and it could save your life. Always, always wear gloves when you even think that there may be hand contact with blood or other potentially infectious material. Remember to replace gloves if they become torn or punctured. If you can't find gloves, make sure you find a barrier. Even a trash bag will do. You can use utility gloves that can be washed and decontaminated for reuse, but they should be discarded immediately if they show any signs of cracking, peeling, tearing, puncturing, or deterioration. The key to removing your gloves is dirty to dirty, clean to clean. This means contaminated surfaces only touch other contaminated surfaces. Your bare hand, which is clean, only touches clean areas inside the other glove. Here, let's take a look. Take hold of the first glove at the wrist, fold it over and peel it back, turning it inside out as it goes. Once the glove is off, hold it with your gloved hand. To remove the other glove, place your bare fingers inside the cuff without touching the outside of the glove. Peel the glove off from the inside, again turning it inside out as it goes, and use it to wrap up the other glove.
Got it.
Remember to immediately remove your PPE and dispose of it properly, especially if it's become contaminated. And do it before leaving the area. Don't risk spreading the exposure. Whoa, wait a second.
What?
You can't just throw sharps into the same receptacle.
Sharps?
Any sharp object has a potential danger to cause injury, and they're even more dangerous if they're already contaminated. Broken glass, scalpels, diabetic syringes, or even pens and pencils could become a contaminated exposure risk. Engineering controls like a sharps container will keep them isolated and prevent further injury.
So where am I supposed to put this?
Contaminated sharps should be discarded immediately in containers that are closable, puncture-resistant, labeled, or color-coded, as well as leak-proof on the sides and bottom.
Work practice controls are actions that reduce the likelihood of exposure by changing the way a task is performed.
It's as simple as this. Never pick up contaminated broken glass by hand. Always use mechanical means such as a brush and dustpan. Just think and be careful. Don't push down overflowing garbage into trash cans. You never know if there's a contaminated sharp waiting to cut you. When you carry a bag of trash, always hold it away from your body to avoid getting punctured in the legs. Good job.
Oh, me? Thank you.
If any surface or object has been contaminated, it must be cleaned with an appropriate disinfectant, such as a diluted bleach solution.
Anything else?
It may sound simple, but basic hand washing remains a fundamental element of infection control, especially since gloves may not provide complete protection against bloodborne pathogens.
I think I know how to wash my hands.
A little technique never hurt anyone. First, wet your hands and apply liquid or clean bar soap. Next, rub your hands vigorously together and scrub all surfaces. It's important to continue for 10 to 15 seconds. Some people find it helpful to hum a little tune to themselves, like Happy Birthday. It is the soap combined with the scrubbing action that helps dislodge and remove any pathogens. Then just rinse well and dry your hands.
I never knew you had to scrub for that long. I thought just a few seconds was fine.
I'm afraid not. Just remember, whenever you come in contact with blood or other potentially infectious material, always wear gloves and always wash your hands as soon as you remove them.
Got it.
Now that you've heard all you can do to protect yourself from an exposure, what do you do if an exposure actually occurs? First, don't panic. Most exposures do not result in disease transmission, but be safe and wash the exposed area with soap and water. If blood or other potentially infectious material has been splashed onto your face or any open cut or abrasion, flush the exposed area with water. If any contaminated substance gets in your eyes, irrigate your eyes with water or saline. Then report the exposure. It's important for your school to keep accurate records of any occurrence.
Let's fill this out first.
You should see a doctor as soon as possible after an exposure, preferably within 24 hours and no later than 7 days. You have to assume that any blood could actually be infectious. Now that you're aware of the dangers of bloodborne pathogens, you know how important it is to reduce your risk of exposure. It's unfortunate that you have to be aware of hepatitis and HIV in schools. However, the recommendations you've been given are really quite simple in comparison to how dangerous the contamination could be. Using precautions consistently, even when it seems unnecessary, and following the proper steps after an exposure could save your life, or the life of another educator, or another child. It's up to you.